You wake up with foot pain. When you step on the floor, you feel terrible pain, especially after sitting or lying down for a long time. I am Dr. Kelvin. In this video, I'll show you how to get rid of it for all. A foot pain caused by plantar fasciitis. Plantar fasciitis is a simple condition to identify because it is characterized by a very sharp pain in the heel or in the sole of feet. It were a pain from stepping on the tip of a knife. Especially when you wake up and take the first step in the morning, it's like your foot is tearing from the inside. But did you know that your calf, your glut, your footwear, and your diet are related to fasciitis, plantar, and with the pains you are feeling? So stay until end of this video, because I will explain these correlations and how to treat all this, combining the almost 10 years of experience I have studying feet. The first reason for your pain is that your plantar fascia, this membrane that is beneath your foot, serves to provide support and sustain the plantar arch. It receives some tensions that it shouldn't, due to some dysfunctions with some parts of the body. First cause of your plantar fasciitis is the shortening of your calf. They different structures, but they are interconnected through the fascia. I will demonstrate with this tape. Here, I'll stick it on my leg to see better. If my calf muscle is shortened, this will create an overload on my calf, which will be transferred through this fascia here, look, to my plantar fascia, causing pain and inflammation, characteristic of plantar fasciitis. When my calf is shortened, as in the tape example, it limits this movement here, look, this dorsiflexion movement. When I walk, ankle dorsiflexion, creating even more tension and overload on the feet, which contributes to my plantar fasciitis. And the stretching we are going to do is, in this position, look, thinking about releasing the tension of the plantar fascia through the calf. So what you are to do is look, keep one foot ahead, with the knee bent, and other foot behind, with the knee straight, and with the back leg. You must not lift the heel off the ground at all. Now draw an imaginary line from the tip of the big toe back there to the front of your body, and the foot that is in front should cross this line to the other side. Bring both feet together. Cross this imaginary line one more time, and then you will be doing this mobility exercise for 20 repetitions. When you reach 20 repetitions, you will simply stretch. So remain in this position for at least 40 seconds. You will do this exercise 3 to 5 times a day, every day. So save this video somewhere, so you can come back here every day and repeat with me. Exercising. And don't forget to leave your thumbs up. Subscribe to the channel. We are aiming to reach 1 million subscribers, so I'm counting on your help. Subscribe to channel. What are you waiting for? Go ahead and subscribe. You write it down. I'll wait. Very well. The second cause of plantar fasciitis is your glutes. Doctor, what do my glutes have to do with it? When your gluteus medius is weak, this weakness is reflected in your foot, and your foot drops along with your pelvis. There's even an office test that I do, which is the Trendelenburg sign. We ask the patient to stand on tiptoe, and if the gluteus medius is weak, the hip will collapse. But this collapse is also reflected in the foot, and these biomechanical dysfunctions that occur in the foot, due to the weakness of gluteus medius, this can overload your plantar fascia. For this, we return here to our wall, stand supported on one foot, and we strengthen one side of the gluteus first, and then we strengthen the other side. So I come here and stand on the tip of one foot, only the foot that is on the inside of the wall, the side near the wall. I will lift this foot, all right, and my hip, I will try to bring as close to the wall as possible. And I return here once again, as close to the wall as possible. And I return. On this return here I will engage my glutes, so I will be contracting them squeezing the glutes on the return. So I go close to the wall and return. Notice that my foot here. I came a little further back here. Notice that on this return here, my foot remains aligned. So I work not only the glutes, but also the stability of my feet. I do this for 3 sets of 8 repetitions. And as it becomes easier, this exercise, I will increase to 9, 10, 11, 12 repetitions per day, 3 sets, 12 repetitions. And this way I strengthen my glutes, which will correct my step down very well. The third cause is inflammation. If you have plantar fasciitis, it means your plantar fascia is inflamed. And that's why you feel pain. Every word that has the suffix itis in medicine, this itis refers to inflammation. Therefore, fasciitis is an inflammation of the plantar fascia, and the main signs of inflammation is heat. We control the heat. Was something you have in your fridge at home. I will teach you how to do an exercise, followed by a compress with a frozen bottle. Look here, you will lay a towel out in front of you and place bottle on top. And now with your feet on the bottle, you will do a back and forth motion. Then you will count 6 seconds to go. Then you will count 1, 2, 3, 4, 5, and 6. And you will return with your foot sliding over the bottle 6, 5, 4, 3, 2. When you will do this back and forth motion for 5 minutes, okay. After that, you will then take your towel and cover. Just don't wrap the towel. You will cover the bottle with the towel. And then you will do another 15 minutes of compress. You will step on the bottle that is covered with the towel. You will do 15 minutes of compress. That's because, as I've mentioned in several videos here, ice is an analgesic. It is anti-inflammatory. The fourth cause is footwear. Because what you wear on your feet has a correlation with your pain and your plantar fasciitis. Time when I get the most patients with plantar fasciitis, which is known as the time when my videos about plantar fasciitis receive the highest peak of views, is in the summer. That's cause in summer. We wear a type of footwear, a big problem for plantar fasciitis, a flip-flop, like this one here. Not this flip-flop, but also any other type of footwear that has a sole that's very soft. In addition, sandals, slippers, and so on. When I walk with this type of flip-flop, my foot makes this movement here of hyperextension of the toes. And since the plantar fascia is directly connected to the toes, every time my foot makes this movement here, I cause tension in my plantar fascia, literally injuring again and again the fibers that should be healing. So instead of using these soft shoes that bend too much, that slip off the foot, this way, to use this type of shoe here, with a more rigid sole, I can't bend it. I need to use a lot of force to bend it. These shoes with a more rigid sole, we call them rocker shoes. When you walk in this shoe, it does on the ground, like a rolling motion, so it prevents the hyperextension movement of your toes. When you make the hyperextension movement of your fingers, you keep pulling your plantar fascia all the time. When you wear this type of footwear, while you walk, there is no stress. Therefore, the fibers of your plantar fascia stay more still, so they remain resting and healing while you walk. There is a video on my channel where I talk about this type of footwear, recommendations brands. I will leave link here in the description of this video. And cause number 5 concerns diet. Often the villain that is not allowing your plantar fasciitis improve, that is not letting this inflammation heal. Often this villain might be on your plate. I have hammered this numerous times here on my channel, and the first thing you need to do if you want to avoid pain and inflammation in your body, as in the case of plantar fasciitis, is to avoid these foods that enhance inflammation, such as ultra-processed foods, sugar, trans fats, fried foods, snacks, sausages, salami, ham, processed cookies. All of these are foods that worsen your plantar fasciitis, that are preventing you from stopping, feeling pain in your feet. And that's why they need to be avoided. In your treatment, it's no use you to stuff your self-medication. Do the exercises from this video, but not remove these foods from your plate. And that there are some vitamins and minerals that are worth supplementing. If you have plantar fasciitis, the first vitamin I would supplement is magnesium, which is one main calcium regulators in your body. One of the first symptoms of magnesium deficiency in your body happens first in the lower limbs, like cramps in the calf, in the feet, and especially plantar fasciitis, which is correlated with this magnesium deficiency. Calcium is a mineral that is correlated with magnesium. If you have a magnesium deficiency, which is the mineral that will balance the calcium levels in the body, you will have excessive calcium. And of the first symptoms of excess calcium and lack of magnesium in our body, plantar fasciitis, the magnesium that I recommend to my patients is glycinate, 400 milligrams, because has greater bioavailability in your body. Another supplement quite important for you with plantar fasciitis, heel spur and other types of pain, inflammations in body is vitamin D, one of the most potent natural anti-inflammatories that you can have for various pains and inflammations, not just from plantar fasciitis, that you can consume every day with a lot of safety, because it has no side effects. The minimum dose for you to reduce these inflammations is at least 10,000 units, international, every day. If you have a vitamin D deficiency, you will feel pain, inflammations due to its lack, not just in the feet, but in other parts of the body, like in the lumbar spine, in the immune system, and you may also feel muscle pain because of this. I hope I was able to help you. Follow all the tips in this video. Stretch your calf. Strengthen your glutes. Apply ice packs to reduce your inflammation. Avoid very soft shoes. Look for shoes with a more rigid sole. And in addition, take care of your diet and your supplementation. Certainly, these alternatives are much more effective than doing electrotherapy and ultrasound on your foot. Does not replace consultation with specialists. If you have further questions, or if the symptoms persist, seek a specialist to take care of your feet and schedule a consultation online with them. I see patients all over Brazil, US, Europe. Just click on the first link in the description of this video if you want to know which shoe models I prescribe for me patients in the treatment of plantar fasciitis. Since there wasn't enough time to talk about this in the video, there are many things, but I have several other videos on plantar fasciitis on YouTube, and the video about shoes, shoe models for the treatment of plantar fasciitis is this one that's appearing for you watch. Just click on this video here and I'll see you there.